Okay, the first task was recorded. Now we will go ahead with the next task. Is Dr. Sai is there? I don't think so. She will be here because I couldn't able to add most of the people. The first task was recorded properly.
Okay, thank you, madam.
Okay. Would you like, means anybody wanted to do the task for her on her in her absence? Hello. Anybody? This is urogyne task. Another lengthy topic. What I will be saying.
Ma'am, so in the previous case, time management, right, ma'am? Anything else to
Very
be?
important. See, whenever you see a male infertility task, you just see that your history taking will be very, you need to have, so that's the reason this infertility, male infertility, your questionnaire should be very much fixed in your mind. Okay, something like ratto, or what we say. That means you just need to mug up the template very fast. I am not very pro for template, but in male infertility and urogyne task, you just need to mug up the template here.
Okay, ma'am.
It is very important. It is very important because see, unless and until we will not do that, we will not able to do it fast. And interpreting whatever has been given to you should not to take so much of time. You have to
Okay, ma'am.
interpret.
Okay.
Okay.
Yes, ma'am. Okay, ma'am. Thank you.
Who will be, Miss, is there anyone who would like to present the next task? Anybody? Muthulakshmi, would you like to do? Because I may not be able to take the third task.
Okay. I thought someone will do since I'm doing the third task.
Third task, if that, anyway, if we will not able to record it, then it is not going to be of uni use. So at least we will able to record this task.
Oh, okay, ma'am. Just a minute.
Anybody wanted to do it?
Pilvesh, நான் உள்ள இருக்கேன் என்ன டிஸ்டர்ப் பண்ண வேண்டாம்னு சொல்லிரு 10 minutes.
Anybody is interested? If I will ask someone else to do it. No. See, it's a continuous process. Preparation is a continuous process. You need not, till the time you will not pass this exam, nobody should be off preparation. At any point of time, if someone asks you to present, please present here. Okay.
No one is there and I can present, ma'am.
Yeah, no one is there today. Okay, so
Okay.
starting your time.
Yes, ma'am. Next page.
3 pages. Okay.
Okay, ma'am. Next page, ma'am. Next, ma'am. First page, ma'am.
Okay, started your 10 minutes time.
Hi, I'm Dr. Muthulakshmi. I testify doctors in the clinic. How may I call you?
You can call me Sasha.
And can I confirm your age, please?
I am 40.
And Sasha, first of all, I apologize at the outset. You have come to see my consultant, and unfortunately, he's not available at the moment. And is it okay to continue the consultation?
Okay.
Okay. And Sasha, I can gather from your GP letter that you have come here with some concerns with your water work. Am I right?
Yes.
And Sasha, since we are meeting for the first time, and I need to ask few more questions to know more about you, then we'll plan a suitable management for you.
Okay.
And please tell more about your concern.
Um, my basically doctor, I'm a teacher,
Mhm.
and after my second delivery, third
Mm.
delivery, I have noticed that I need to means I leak whenever I cough, laugh. But recently, I have noticed that I need to go or rush to the toilet, and if I will not go or rush, I may wet myself. It is very embarrassing. It is very embarrassing because the class students will be there, and I have to rush, I have to run. I am fed up of all these things. I'm really struggling with the symptoms, doctor.
Sorry to know, Mrs. Sasha. So, you are going through a tough time, and we are here to help you. Okay.
Yeah,
Okay. So, and how many times do you pass urine in the daytime and in the night time?
I think every 15-30 minutes, quite frequently, even at night. Also, I do need to get
Mm.
up multiple time.
And has the GP prescribed a bladder diary?
No, he said that I need to go and see you.
Okay, so I'll explain that in a while. And do you had any time urine infections before?
He has given me some antibiotics, treated
Hmm.
for urinary infection, but it has not given me any relief.
So, and any blood in the urine?
No,
And any time you felt incomplete emptying?
not incomplete emptying, but this rushing is very frequent, doctor.
Okay. So, uh, any mass in the tummy
Mass in tummy, no,
and any swelling in the vagina?
no,
And any abnormal vaginal discharge?
no,
And any concerns with the bowel like constipation?
no.
And are you up to date with your smears?
Yes.
So, y- please tell more about your periods.
My periods are pretty regular. My last period was 2 weeks back.
Okay. So, you said you had three kids, right? So, all the vaginal deliveries?
Oh yeah, they were vaginal. Two were instrumental deliveries, and they were quite big, doctor. I had to go through a lot during my labor. It was quite prolonged deliveries.
Okay. So, sorry to know, Sasha. And do you had the same problem during the delivery or a post delivery, like leaking?
No, I told you, means my younger one is 2 year old, and after that only I have noticed that this symptoms has been started, that leak has been started, but this rushing is just a recent one.
So, have you done any exercises for the muscles, that pelvic floor exercises before?
Yeah. The GP just mentioned that I need to do this miss exercises. I'm trying, but it's not giving me any relief. And he also said some control on this weight. I'm a little on a higher side.
Yes. Mm. So, any medical conditions like high sugars, high blood pressure?
Yeah, actually, I have been diagnosed with diabetes
Mm.
after the birth of my second baby, and
Mm.
I'm on metformin.
And your sugars are under control?
Yeah, pretty much under control.
And any allergies you have?
Yeah, I do have a plaster allergy, but it's just a
I
occasional
I-
rash I do have. Do
okay,
get.
so I will note it down. And any surgeries in the tummy or in the vaginal area or any urine problem before?
No, no,
Okay. And so few personal questions. Do you smoke?
Yeah, I do smoke.
Okay. Have you thought of quitting?
Yeah, GP also suggested. I will think of it.
Okay, so I'll connect to NHS support program if you wish. And do you drink alcohol?
Occasionally in the parties, not regularly.
Okay. And your height weight ratio?
I am having a my weight is little on a higher side, doctor.
And blood group?
I don't know. I think it's A positive.
So whom do you live with?
I stay with my husband and three
Okay.
kids.
Okay. So how was your support at home?
Yeah, it's good.
So, so Shasha, shall I examine you in the presence of a chaperone?
Okay, yeah.
You will check your observations and the tummy and the vagina to check any leak or any dryness or any moss you're feeling. Okay.
Okay.
So, any recently you done any test like sugars or a urine?
Uh, he has no, I have not done.
So, coming to your condition, so let me draw for you. So this is the bladder, which we'll call as a water bag, and this is a water pipe, urethra. So through which urine comes out. Okay. So what happens is sometimes the bladder so contracts on its own whenever it is not needed. And this is called an urge incontinence. Have you heard of it?
Yeah, no, never actually. Was something to worry about.
So no, this all these conditions are treatable if you follow proper treatment. Okay.
Okay.
And also another thing is so normally this water bag bladder and the urethra at the junction there will be one muscle we'll call them as a sphincter, so it will be usually closed. Sometimes what happens is this gets weakened, so whenever there is a coughing or a laughing so there will be a leak. Okay. So
Okay.
that's why you're having a leaking on coughing that's which is started after the delivery, and it is common to see this in women who delivered more deliveries and big babies and also women with diabetes.
Oh my God. So
So
what now, doctor? How you are going to get me treated?
yes, so we'll don't worry, this is a treatable condition. So since this both types of urine leak is there, so we'll call them as a mixed incontinence.
Okay.
So first we need to check again your urine for any infection. So we have to treat it first, and to check the control sugar control. How was it? Okay. And
Okay.
also we need to check any urine is remaining in the bladder after you pass urine.
Okay.
So the first line is usually a conservative management. Okay. So
Actually,
again,
doctor, I'm suffering a lot, and
yes, yes.
I rather than having this conservative or wasting
Mm.
my time, I would like to have any surgery if it will be available.
Yes, so your further care will be taken care by the my consultant, continence nurse, and the urogynecologist, GP, and the support groups. So usually the surgery is not offered as a first line, and so we need after conservative measures and after medicines and also after correcting the risk factors like sugars, urine infection, and the reducing the weight to some pounds, so which helps in curing of the symptoms first and also reduces the failure of the surgery.
Okay.
Okay. And we need to do a special test called urine flow test, urodynamics, to see like which type of incontinence is predominating.
Okay.
Okay. So along with the exercises, which will be supervised by the physiotherapist, pelvic floor exercise you are doing, and doing some lifestyle measures, eating healthy diet, avoiding smoking, it also helps in improving the symptoms a lot. Okay.
Okay.
So
Yeah.
other option is to go for a bladder diary where you will note it down how much urine you pass and how much fluid you drink. So it helps you some clue to how to treat this. And
Hmm.
also another conservative measures we start with is a bladder retraining. Have you heard of it?
No.
Okay, there we'll void up, I mean, where we'll place some intervals to pass the urine like 1 hour once. Then it can be increased slowly. So slowly it helps our bladder to get controlled. Okay.
Another 2 minutes, shall I give you?
Yes, ma'am.
Okay.
And to having this rush problem, so we'll start you on a medicines and which anticholinergic, so which will release some happy chemicals which helps in improving the symptoms. Again, this need to be taken for a 1 month to see its effect. Am I clear so far?
Okay, and for this actually this leak when I cough, what I need to do for that?
Yeah. So first following this conservative measures. Okay, so then after medicines, then after improving the symptoms, then after planning the special test urodynamics, then we can plan for a surgery.
Okay.
Which
Okay.
will, okay, so you want me to explain?
No, doctor, that's it. So as of now, you are going to give me this investigation, some treatment, some medication.
Yes. Yes. So I'll book an appointment with my consultant, and also I'll give a patient information leaflets on mixed incontinence. So I'll document in your notes, and also I'll connect to the support groups Bladder UK, and I'll write back to your GP regarding a further plan.
Thank you, doctor.
Thank you.
Okay. Anybody would like to comment on her performance? Wonderful. Done very well. Time management is again an issue because
Yes, ma'am.
urogyne, as I told rightly,
Yes,
is
ma'am.
another module where your time management will go haywire. You took 6 minutes time to take a history and examination. At least
Yes, ma'am.
4 minutes, 30 seconds, or 5 minutes. You have to minimize. So in those cases, please, in your introductory words should be very minimized,
Yes, ma'am. Should short.
very short, so that you will
Mm. Get
immediately
time.
enter into the task. Okay,
Mm.
start eliciting the history. So that is my concern. Anybody would like to comment on this performance? Shall I, shall I give my, okay. So from where you have noted that the consultant is absent?
It was written, Dear Mr. Coswell, that GP letter.
They will be writing it down,
But
but
you need not tell, ma'am, that thing.
yeah,
I
if
don't
it
see
has
it.
been
It is.
mentioned, yeah. See, there might be sometimes the consultant is seeing other person, patient. You will be in consultant clinic. You might be seeing simultaneously. The consultant might be there. If it has not been mentioned, means particularly, then do not say that.
Okay, ma'am. Okay, fine.
Okay, so you have been referred to the consult. Yeah, max to max, you can just say that consultant is absent. Don't assume. You can say that you have been referred for the consultant, but will it be okay if I continue the consultation?
Oh, okay, ma'am. That is fine.
Okay, this is a better phrased
Yes, ma'am.
sentence. Okay, so that is okay. Now coming to the answer key of this task. Okay, aim, setting, agenda, you could minimize those problem. You could minimize those problem. The task what you had elicited, the history was proper, completed. There were few inappropriate questions which I would not like to have it. That is, blood group is one of them. Smear, do you think in urogyne module smear plays any important role?
No, ma'am.
No, I don't think so. So I will not say smear.
Okay.
Most of the time it is not needed. Vaginal discharge also is not needed. Rest of the history was important. Okay. So the rest of the history was important. Only this thing was not important. And I didn't like the way you said when I said, oh, doctor, I had very difficult deliveries. I'm really sorry for that. Do you think that is a wiser sentence? Sorry, sorry is not a new word which needs to be used here. You can use any other word.
Okay, ma'am.
Okay, so it must be very difficult for you. It must be very tough for you. Something like that. Saying sorry, sometimes it's like whether I had delivered babies, all those are mixed feelings, but a difficult time, a tough time. Okay, so don't feel sorry for that situation. You can just say, oh, it must be tough for you. Something like that.
Excuse me, madam. Sorry, sorry should be used for any IUFD or something like that, or previous
That, yeah,
traumatic
yeah.
experience.
Whenever there is very really a difficult situation, this is not a difficult situation. It was just a difficult delivery, but the deliveries were normal. Everything was normal. The outcome was normal. So the sorry, using sorry here will not go very good. because I may felt, oh, why she said sorry? Is it because my babies are normal, everything was normal? So if you want to acknowledge that situation, just say, oh, you must be having you must had a tough time at that time, it must be tough or something
Okay,
like that.
if she would have had any tear post forceps delivery, so that would have been a sorry situation, maybe.
Yes, that would have been a sorry situation, but it is just a prolonged
Okay.
deliveries. Apart from that, nothing else was there. It was normal
Okay,
deliveries,
understood.
difficult. It was a difficult labor, must be tough for you. At that time must be tough for you, and it must be tough for you at that time. That suits better here. Sorry, I don't think it suits that sentence. So that is one sentence, one point which I had mentioned here. 6 minutes, you offered me examination very nicely. Then you started explaining me the OAB and the SUI. I don't like the way you explain me OAB. I don't like the way you explain me SUI. Okay. So you can rephrase all those explanation very nicely. You draw it for me. And then the treatment option, yes, it is a treatable. That means you are offering me a reassurance very nicely. Why it is so? The SUI is most of the time it's because of the difficult deliveries. And why OAB? We do not know why it happens. We do not know. But there are association which is associated with that. One is smoking, caffeine. That caffeinated drinking history you missed out. Okay, that history you missed out. And that was also asked by my GP to stop that caffeinated drinking. Okay, habits. Then. Uh, you mentioned that it is mixed incontinence. You checked my background knowledge very nicely. You explained me the modality. I asked you the options. The one of the very important option whenever this kind of patient comes to you, do you think the patient will get relieved immediately from the symptoms?
Like coping strategies.
This is a patient safety point. You had sent this patient without giving her any relief. Okay. So what are the coping strategies? These are the coping strategies.
Incontinence
Whenever
pads, scented
fecal
pads.
incontinence, whenever there is fecal incontinence, urinary incontinence, there will be a pads, there will be a toiletry means this talcum powder, okay, and then the access to a disability toilet, so that they, if at all they will have an accident, they will be eligible to access those toilets. Okay, so it is very important for them. So that is coping strategy. At least take this name. If you are not saying it, at least take. And these coping strategies are most of the times are offered by continence nurse specialist. Okay, remember this. Then the history was complete: leak, crush, frequency, nocturia, pain, sensation, blood, everything was asked. Incomplete emptying, you asked everything. Bowel complaints, bulge, tummy, mass in tummy, no, it's a bulge. Okay, bulge
Okay,
on
ma'am.
bulging vagina. Okay, what treatment have you tried? Okay, so this one of the important point is this: have you tried any treatment for this? You asked me this question. I said no. The GP said that I need to come to you and see you. But he has treated me for urinary infection. If not sent, yes, you had offered me. You do not need at the now. Once I had been treated for urinary infection, you do not need to offer me any other treatment, but you just need to offer me investigations. Okay. Menstrual history you asked me, obstetric history you asked me, medical condition you asked me, allergy or plaster you acknowledged, smoking you asked, you offered me NHS quit smoking services, alcohol you asked me alcohol.
Um,
No, and you
Alcohol, I
didn't.
asked. You told you
Alcohol
drink
you
in
asked.
parties.
Yeah, this caffeinated drink you missed out
Yes,
completely.
ma'am. Caffeinated drink and coping strategies I missed.
Yeah, so these 2 points are missed out. BMI you asked me because it was 87, that was this. Please address one by one, and now you will be going to the options. So you offered me examination to see whether there is any bulge, leak. Okay, then would like to offer you certain investigations. Okay, so you would like to check my infection, you would like to check my sugars. It is very important. Then UDS is an investigation which will be decided by the MDT. Most of the time, if we go for urge incontinence surgery, then at that time generally we do. Yes, the more predominant symptom of mixed incontinence will be treated on a priority basis. This is a general dictum. and the less predominant symptom will be managed conservatively. So looking at her symptoms, we are so you just tell her that you are having both the component, that is overactive bladder and stress urinary incontinence, and we label it as a mixed incontinence. I will label, have you heard about this? Let me explain it to you in a simple language. Okay, the other investigation here is, yes, very nicely she said that a PVR, that means a residual volume was okay, post residual volume, post-voidal residual value, that is one investigation which we need to rule out. Urine infection, urine sugars. So OAB basically, whatever language, whatever things, make it little clear. Okay, so that is my concern here, Dr. Muthulakshmi. So if you want to explain it, just explain her that there is a muscle lining, muscle detrusor which is lining the bladder. Whenever there will be feeling of urine, it is at a relaxed state. It will be relaxed. But and when this muscle contracts, we will have an urge or rush to pass urine. In your case, this muscle is contracting too frequently and giving you rush or urge to pass urine frequently. We do not know the exact reason why this is happening, but yes, it is associated with too much of drinking alcohol, smoking, caffeinated drinks, and enough not drinking enough fluids. So the urine is concentrated and it might irritate the bladder or this muscle. Okay, so you had drawn very nicely. Stress incontinence, you tried to explain me very nicely, that there is a muscle called as sphincter. And it is because of the loose sphincter. Whenever there will be increased pressure in your tummy or in your bladder, your sphincter will not able to hold it and you will leak. And it is because of the difficult or traumatic delivery. Okay, so this explanation was nice. Overactive bladder, you can rephrase the explanation. Damage during childbirth, increased pressure on your tummy because of constipation, cough, and damage to bladder or nearby area during surgery. That is aging, menopause, and obesity. In her case, it is obesity and childbirth. But in RCOG exam, I'm just telling you, it will be her occupation, it will be her difficult deliveries, it will be her asthma, it will be her constipation. Okay, it will be her smoking. So these are all multiple problems which will be associated with SUI in RCOG. Whether any concerns, okay, any expectations regarding the treatment? Yes, I'm keen on surgery because I don't have time to do all these medical treatment or lifestyle changes. You very nicely offered me lifestyle changes, that is reducing the, you didn't offer me caffeine, but yes, I had already been reduced because the GP has suggested me. Fluid, you need to manage your fluid per day. Bladder diary is very important thing. NHS continence services, you will be referring me, and specialty nurse, because this supervised physiotherapy is very important. This physiotherapy, most of the time, this SUI symptoms will, since I'm having a lesser of SUI symptoms, looking at her symptoms, more is my urge. Okay, more is my urge. Supervised PFMT gives me a very good result, and most of the time, 50% of the time, I will get a good result regarding my SUI. So this SUI is one of the important point which I need to manage with the help of pelvic floor muscle exercises under the supervision of physiotherapy. You can explain, you can, if you think you are having time, you can explain squeeze and release muscles of the lower vagina, anus. You need to, and you can do it at any time, 3 to 4 times a day, 10 to 15 times each time. Okay. And if it is done under supervision, we can be done with the help of cones. Bladder training. Okay, so this bladder training is basically, means this is very good sentence what generally I explain it to the student. Rather than bladder taking a control of you, you take a control of your bladder slowly and steadily. Increase duration in between two peeing, or increase the duration in between passing passing urine twice. Okay, so basically you are just explaining them in a simple language, and you need to do it for 6 weeks. Pelvic floor muscle exercises for how long? 12 weeks or 12 to 16 weeks.
12 weeks. 12 weeks,
Yeah, 12.
pelvic floor.
But this is the nice guideline, but you need to continue beyond also. That
Yes,
is a term where till that time, means they just wanted to tell you after that you will get a result, but after that also you can continue. Till that time, a stopgap. is a continence product. Yes. Okay. Now the MDT will be formulated and we will discuss the options. The more predominant symptoms will be treated. Surgery, yes, if you want to go for a surgery, this will be the last resort because it's an invasive procedure and it is associated with its own risk and complication. If we would like to treat you for OAB or overactive bladder, then retention of urine is another symptoms which may occur because of the surgery. So there are medications which is very good. These medications are very good, happy chemicals, whatever it relaxes the bladder muscles and it you will start seeing the effect of this muscle. Okay, the side effect, you need to explain the side effects. What are the side effects? Constipation, dry mouth, dry eye, and sometimes insomnia. And the last option will be surgery. If she's keen on surgery, you just need to ask her particular reason. Here I myself told her why I wanted. Okay, group of medications, different patch, different mode of act, different doses, different types, and different routes. So we can offer you a combination on permutation depending upon your response and how good you are tolerating it. So yes, you will be reviewing her after 3 months, not after 1 month. Generally, the NHS will give appointment in this case after 3 months. Okay, and she can visit a GP for if she is getting relieved. So she can visit a GP and collect all the medication. SUI, most of the time it will respond to physiotherapy, which you have missed out how the SUI is going to get relieved. Along with incontinence product, along with these measures, your further care will be in a local MDT again. If no response, then we will discuss the options of surgery like Botox injection or SNS or TENS in her case, and a tape procedure for SUI. So these are the surgeries which we will be discussing. Those are the surgery which is associated with the risk of anesthesia, risk of surgical complication, infection, injury to the nearing organ, and sometimes a new onset urinary complaint. So these are the risk associated with surgery. So this will be done by the last option if not getting relieved with the simple measures. So MDT, failure to respond first line measures, then only she will be offered surgery. That we need to tell her. So as of now, first line therapy along with coping strategy is her important take home message. Then close the loop with follow up with the consultant after 3 months. Okay, so close the loop. Basically, you just need to tell her that whatever we had discussed, we will be documenting. I will be offering you patient information leaflet regarding the incontinence, urinary incontinence here. The Bladder Bowel UK Foundation or Bladder UK, these are the support groups. Whenever you are going to explain the patient information leaflet and support group, be specific of that support group. Your job is to done. The MUI is management is most of them. The most predominant symptoms or components will be discussed here. Now coming to the information gathering or domain-wise scoring, you had elicited a very detailed history. So in information gathering, I will give you full on. I think you had asked all the points which are there. Yes. Then communicate with patient and families. You were able to communicate with me very politely, and there weren't any disharming words. So they were also very nice. So even this I will give you a clear pass. So you had explained me the reason why I'm having this mixed incontinence. You didn't encourage me for physiotherapy, but that is very important thing. Consider me for bladder training. You offered me fluid diary. You discussed the pros and cons of options. You didn't discuss the pros and cons, but at least you mentioned all the options to me.
Yes,
Okay?
ma'am.
The complication of surgery, you missed out on that because so we will give you borderline in that way. Okay, the overall communication with patient was good, but when it comes to giving a information piece of information, that was missing out. Senior colleague or consultant, physiotherapist, GP, continence nurse specialist, you missed out on that, and eventually MDT.
Continence nurse, I told mom in the MDT.
In the MDT you mentioned.
Yeah,
okay.
Yeah.
Then I will consider it. Okay. Coping strategy here, patient safety, I will give you a borderline.
Yes,
okay.
ma'am.
So coping strategy is my important point here because that is what you are supposed to give me as at this point, along with physiotherapy and bladder training. And this rest of the points you have mentioned here. Applied clinical knowledge, you just need to explain the diagnosis, what is the reason for that condition, what will be the management. So overall maximum points you missed out. You mentioned only point which you missed out is physiotherapy. You just missed out on this physiotherapy. Most other points has been mentioned very nicely here. Okay, so applied clinical knowledge, and since you have not mentioned this physiotherapy, I will here again also give you borderline. Okay, a good task overall. Okay, I will see the battery life and then we will decide for the third task. Okay, just wait.